Judy.
Judy?
Yeah.
Hey.
We're on? Okay, well, I'll wait for you to come to the seat. And I think, how, if you please sit over here so I can see the clock because you're blocking me too. Yeah. Okay, well, good morning, everybody. Good morning to everyone watching us on YouTube. So it's a nice morning and welcome back, Rebecca and Dan, and welcome, Brandon. This is your first time.
Well, second time.
Second time?
A couple years ago, I attended one
Here?
session. Not
No,
in person.
yeah.
Virtually.
I think you did it virtually. Yeah. In the not here though.
No.
With the class with a master. Yeah. But we've been doing this for a while. So since you're new, I don't know how much you remember from that class with master. So here we practice together and also to help whoever wants to learn from us the practice, the basic practice of meditation. You know, I know enough to teach the basic, and so meditation is the practice of raising awareness. So raising the awareness of our senses and also our surrounding. And it is a learned behavior. Nobody gets there without practice. And through learning and through practice, we get better at it. And why do we need to raise awareness of our senses and our surrounding?
Heightens our consciousness.
Yeah.
Makes us more self-aware. Makes us aware of bad habits that we need to change.
Yeah.
Also awareness of our thoughts.
Yeah.
Also makes us aware of how we interact with other people and the world in general.
I feel like it's almost being removed from the rat race of society of go, 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 that makes you take a moment to breathe, because it's interesting that nobody, what do you mean, knows how to breathe correctly.
Yeah.
So I think it's just more of just like stopping, taking a moment of just life and breathing.
Yeah.
Otherwise it's always
and not a lot of us practice meditation, right? So when they did the survey, they found out that, well, this survey was done several years ago, but back then there was only about 10% of the population practice meditation. Now I think there is more and more, but I don't know if there is an up-to-date figure. But even if there is more, I don't think it reaches 20% yet. So still a minority of us are practicing meditation. But how does meditation help us in general, apart from raising awareness of our thoughts and our action and our senses? What can meditation help with?
I'm not sure how deep.
Lowering stress.
Lowering stress. How?
I was thinking the vagus nerve.
Yeah, lowering the heart rate and the blood pressure.
Activating the vagus nerve.
Yeah, activating the vagus nerve.
What's the vagus nerve?
It's sorry. For some reason I always didn't want to call it Vegas because it's so weird sounding.
So what happens when you go to Las Vegas? You get nervous.
Yeah, exactly.
Right.
There's two parts of the system: the vagus nerve, the parasympathetic.
Yeah.
And can't think of exactly what the vagus nerve. I know it runs from your whole body.
Yeah. So
I'll let the expert explain it better than my mom, please.
yeah, so we have an autonomic nervous system that consists of the sympathetic nervous system and the parasympathetic nervous system. So the sympathetic nervous system helps us to, deal with stress, right? Fight or flight action. whereas the parasympathetic nervous system is the one that makes us calm. And when you have an imbalance of the two, your body is going to be sick, right? Chronic imbalance.
I've been there.
Yes. So the vagus nerve is the main nerve of the parasympathetic nervous system. It's the 10th cranial nerve that runs from the brainstem down to the abdomen. It's a very long nerve. And then it has a lot of branches. And all the branches go to all the internal organs inside of you. So when you activate the vagus nerve, signals will go to the internal organs, telling the cells what to do. So when you activate the vagus nerve, the body will go through changes, hormonal changes, physiological changes, biochemical changes, and neurological changes. And those changes actually bring about changes in your body and your mental state too. So it helps both physical health and mental health. By default, if you practice it day in, day out, and you activate the vagus nerve day in, day out, you heighten the parasympathetic nervous system, and also those changes that are ongoing, you cannot stop it from happening, right? Because it comes with the signal from the vagus nerve, and by default, your certain hormones that help you to de-stress gets higher, and then automatically you become a calmer person. So let's say that something that caused you to be stressed and anxious in the past, if that thing happens again now with you having the benefit of practicing meditation, you wouldn't react the same way as you did as before. It works. It does. I mean, it just calms you down.
So it changes your response to
Yeah.
stressful situations.
Right. And they prove it by research. I mean, meditation, the benefits of meditation have been proven by many studies, thousands of it, and they prove it by scanning your brain. They measuring your blood pressure, measuring your heart rate, and seeing how you sleep, and so on. So the topic that I picked today is to talk about how meditation helps people who have traumatic experiences, PTSD and childhood trauma and things like that. So what do you think? Can we use meditation to help people with PTSD and childhood trauma, or whatever trauma? Yeah. In what way?
I can speak from my own experience, actually. So when a child goes through trauma, it creates that fight, flight, or freeze brain, and it never goes away. Basically, your brain is then trained to always have that fight, flight, or freeze.
Yeah.
And then through meditation, I learned to breathe through the fight, flight, or free and calm down and get that vagus nerve to calm everything down. And by doing that, then I didn't have the cortisol and all those stress hormones always running through my body. And I really believe that's what made me really sick, was the stress of those stress hormones. So basically, it's just retraining the brain.
Right.
Right. Retraining the brain.
Yeah. So meditation practice can actually change your brain activity. It rewire your brain activity and make you more resilient. We talked about resilience last year, how meditation helps to improve your resilience. And I think this morning I listened to a TED talk given by a veteran. So he shared his story about traumatic experience in combat, and so he quoted a number of how many veterans suffer from PTSD, but he went through all the treatment available at the VA, and he explored Western medicine, Eastern medicine, and everything, prescription drugs for anxiety, and he just could not overcome it, even with medication. And then he resorted to alcohol to be able to sleep at night, because he couldn't sleep at night because of all these traumatic images keep coming into his mind. And then so he resorted to alcohol to try and sleep, and then it affected his behavior. And so that constant chronic stress led him to be very physically sick. So he started to have poor gut health. We know the brain and the gut are interrelated, right? The gut is the second brain, but the mental stress chronically caused him to have poor gut health. He started to have IBS, and then physically he developed chronic pain, yeah, fibromyalgia, and then joint pain and all of that. And it came to the point that he was so sick, the whole body broke down, and he was hospitalized and everything. And then it was through a meditation training class that he was able to sleep at night without medication. And I had to look him up. I just listened to him this morning, but he started a non-profit organization to help veterans get through their PTSD by sending them to meditation class for 4 days.
Is he in state or?
No, he's at another state, not here. But he was asking for people, if you know anybody, just send them to his organization so they can get through their PTSD experience by meditation technique.
That's probably the most common
PTSD,
observed
yeah,
have some form of
yeah,
PTSD.
yeah. But like in my practice now too, when I was practicing traditional rheumatology, the way we were taught how to take a history is to just find out when the symptoms started. When did your pain start? But now that I'm practicing functional medicine, we were taught to go all the way back to birth, even in utero, to try and find out what exactly triggered the symptoms. So not when the symptoms started, but now that I have started to take a long history like that, I have patients sharing such sad, traumatic life experiences. And then I understand why they got to this place, why they get sick. Because for so many years, they had mental stress.
So even the stress that mom experiences during the
Yeah,
childhood
yeah.
Actually, it goes further back than that. The grandma genetically can change the DNA from traumatic stress.
Right.
Wow.
It's
genetic.
epigenetic.
Does that blow your brain?
Right.
I wonder how the father
A father
in
can
birth.
too, yeah. Because, you take half of the chromosomes from the dad.
Mhm.
So on the dad side, if there's emotional stress that lead to the change of the gene expression, right? And then so it changes the gene, believe it or not, traumatic stress can cause mutation of the gene.
So
But
like if dad has job stress or dad is an abusive person, that can cause the baby, that unborn baby, to really suffer.
if it affected the gene of that father, in the gene expression, right? It's all about not the presence of the gene only the presence of the gene only plays maybe 20% of how it contributes to illness. What happened to that particular gene is more important. Okay, so is that gene highly expressed or very little expressed? Okay, and what influenced that gene? So if the dad's life is very traumatic or had something that changed that gene, initially the dad, let's say it can start with the dad. If the dad has that normal gene, but something happened in his life that caused that gene to mutate, you can't change. Once the gene mutates, you cannot change it back to how it was. So that mutated gene can be passed down to the child. But yeah, but let's say that mutated gene is not expressed. Then even though the baby inherited that mutated gene, as long as it's not expressed, then the phenotype doesn't come out. Phenotype is what it happens to the physical body. But if that gene is highly expressed, then the phenotype will come out.
So it might come out much later.
It can, yeah. So that's how epigenetic now is more important than genetic. You can go and check if you have that gene or not, but if you do every single thing right to keep that gene quiet, not expressed, then you won't get the disease. Like not 100% of women who carry the BRCA gene will have breast cancer, right? Why is it that in the same family, 3 or 4 sisters have the gene, but only one develop cancer? Because of what's going on in that person's life. You know, stress, environmental factor, that person may live in a different area than the sister, or poor diet that make that genes to be expressed and then cause cancer. So
Another thing I was going to say on your point too is that a lot of people who adopt, if they adopt the child as a baby, they make this assumption that because the baby was a baby, they shouldn't have any traumatic experiences from adoption.
mm,
But there is actually a traumatic experience of that separation from the mom and the baby, because the baby was with the mom for 9 months, you know, the sound of her voice, and they're already bonded basically. And when you cut that bond is where then will have that. Yeah. And people who adopt babies don't always understand what they're going through with child's behavior, and it could go back to that.
Yeah.
As you were talking about this, I was thinking about together.
Start off negative.
Yeah. So like
They can get positive.
yes, through learned experience. So with mindfulness meditation, our basic tool to help us to get into the practice is the breath work. And you have to breathe in the way, if you want to get all the medical benefits to come in, the longer you practice the breath work, the more medical benefits you will have. For example, if you practice it for half an hour or more, then your chronic pain and your chronic inflammation level will go down, but it also influences your gene expression. If you do it for a few breaths, 1 minute, 2 minutes, it's not long enough for the vagal nerve stimulation to influence the gene expression inside your nucleus. But if you do it for half an hour or more, it starts to influence the gene expression in your nucleus. And so the genes that get expressed that cause you to have inflammation or whatever, back to your health, can be dimmed down. It's not a switch on and off, it's about like a a dimmer. You
Makes
know,
sense.
when you dim it down to where there is the threshold, then you can kind of stop the phenotype from happening. So I'm going to guide about half an hour practice so we can get all the benefits.
So we have
Yeah.
to put ourselves on
So you don't have to sit cross-legged or anything. You in this practice you just assume whatever position you feel comfortable. You can sit with your legs stretched out, or even lie down if you prefer to lie on the yoga mat. Okay, so I invite you all to assume a comfortable position and then just start to take deep, slow breaths in and out. So the key here is slow breaths, not quick and shallow. And breathe as if you are really enjoying taking in the air through your nose. And when you breathe out slower than you breathe in, because the slower your out breath, the longer the vagus nerve is going to be stimulated. And you can close your eyes or open your eyes, whatever you feel good for you. I have a few patients who cannot meditate with their eyes closed. So just take deep breaths in and out. And as you are aware of your breath, you can kind of control the way you breathe. So when you breathe in, you know exactly how you breathe in. And when you breathe out, you know exactly how you breathe out. So breathing in, I know I'm breathing in. I'm breathing out, I know I'm breathing out. Breathing in, I'm following the air that enters my nose. I follow that air down to my lungs. I notice that my chest is rising and expanding. And at the same time, I notice my abdomen also rises, my tummy rises as I breathe in. And as I breathe out, I follow the air flowing from the lungs up to the nostril and out of the nose. And at the same time, I may notice my abdominal muscle contracting, so my tummy goes inward as I press the air up and out. I'll follow my breaths in and out for a few breaths. And after a few deep breaths, you may notice your body start to relax. You may feel the neck muscle loosen up. You may notice that your facial muscles relax. Breathing in, we know we are breathing in. Breathing out, we know we are breathing out. With each breath, we are returning back into ourselves. We're returning to the present and be in the present moment. And as we take deep breaths in and out, we come to know how we feel in this very present moment. We begin to let go of all the worries, so we can enjoy this present moment. Enjoy our breaths. Enjoy this relaxed state. In this present moment, all we know is how we are right now. We may notice that our thoughts come in and out. That may distract us from focusing on our breathing. When that happens, we tell ourselves, return to this breath. Return to this present moment. We may experience the same thing with other senses. We may see things, hear things, feel things that may distract our attention to this present moment and to the breaths. When that happens, return to the breath. Return to this present moment. And be aware of how we breathe. Breathing in, we know we are breathing in. Breathing out, we know we are breathing out. And we make our out breath longer than the in breath. Oftentimes when we practice, our monkey mind wanders and distracts us from our practice. And when we realize that's what's going on, we become an observer of our monkey mind. We just observe with no judgment. Guide ourselves back to the present moment with the breath. Deep and slow breaths in. Longer, slower breaths out. practice of raising awareness allows us to explore ourselves. It's the time to nurture ourselves. Through this practice, we build our self-compassion, self-love, through the awareness, we may see ourselves expressing gratitude. Deep breathing in, we know we're breathing in. Breathing out, we know we're breathing out. This present moment of awareness, we may start feeling the peace in our heart and our mind. Choose to live in this present moment with peace. It's a saying that whatever we practice will grow stronger. So whatever we want to have in our lives, we practice. Practice love, we will have more love. Our love grows stronger. And once you have more love and compassion, you can start sharing, sending them out to the universe or to whoever you want to share with the image of that person in your mind. Through the practice of love and compassion, you will find yourself practicing forgiveness. when you are so happy being you, nothing much outside can affect how you feel. Through this practice of raising awareness, you become more awake. So for the next 5 minutes, I would invite you to practice in silence. Follow your breaths. The next few breaths in and out, I invite you to return to this space, return to this room, and you can start opening your eyes, moving your hands and feet if you like. So, it's about half an hour practice. And Rebecca has a bad cough now. Okay, so we can do some massage or stretching or whatever, because you've been sitting or laying for too long, you may get stiff or may have some numbness or tingling in your legs, even like me. Are you okay?
Yeah, once the cough happened,
Yeah.
getting it out is just tickling. It's hard to get.
Oh yeah.
Yeah, once it starts, it's like, it doesn't want to stop.
I had the worst cough for like several years because of this tick in the back of my throat that was due partially due to my drainage, but also like acid reflux.
Yeah.
Oh my gosh.
The doctor gave me this nasal spray and also like kind of like Mucinex, I think.
Oh, I know, yeah.
It's Surgerzine or
Okay.
something.
Yeah.
Yeah. Got rid of it.
Oh, yeah. Cool. Yeah. Mine just a respiratory that'll eventually go away.
Yeah.
Just loves me right now.
I had a sinus infection back in June
Horrible. I had that
2021.
for years.
It like caused this like cough that basically stuck with me like on and off for like 2 whole years.
Yeah.
It,
Reactive. Yeah. Okay, well, shall we do some massage? Yeah, just rub our hands together and massage our eyes and face. And we can do this as we take deep breaths in and out too. Yeah.
It's so relaxed listening to my wife.
Oh, I bet. I'm surprised you even hear it.
Okay. Massage your neck.
oh,
Get me in trouble. Seriously. This is supposed to be a safe space.
It's called marriage. It's okay. We all do it.
And you can massage your head too. Head massage can be very relaxing. You can massage your shoulder, your upper back, and massage your arms down to your fingers. Press that pressure point between your thumb and your index finger. It feels good too, but okay. Then you can do the other side.
This is a calming mechanism.
Yeah, it helps relax. If you have headaches, I think it helps headaches too. This here and this pressure point here. Helps sleep.
You guys fighting, you going up to her and starting to massage that part. Calm down. Just weird things pop in my head.
Thank you for sharing.
Anytime.
You can massage your hips and your thighs and your knees and your calves and your toes, your feet. The toes are often the forgotten part of your body more. But they do so much for you. Yeah, so we give them some love. Okay, so Well, we can do a few rounds of walk-in meditation, and then we can sit down and share experience for today. Yep.
Meditation.
Yes. Meditation is not about sitting in one place or lying down. You can do meditation as you walk.
That's been like, I would say probably the most life-changing part is realizing that meditation can be done anywhere,
Yeah. So in any position. Meditation is the practice of raising awareness in the present moment. So basically, whatever you do in the present moment, if you have awareness, that's meditation. Okay.
Now it's called all
Huh? So I'd like to just, so in walking meditation, Brandon, basically it's about having awareness when you walk. So when you walk, you know exactly how your feet land and how your body feels and what your surrounding is. And you can take deep breaths in and out.
I actually used to meditate when I would run on the treadmill at the gym. Focus on my stride.
Yeah.
And
yeah. So I like using the bell because when I ring the bell, it helps me to concentrate. I follow the sound of the bell, and sometimes it brings me back to reality. Okay, focus, right? So I'm going to ring the bell, and you can just walk, like step up slowly with each foot like that, okay? And we start walking. Yeah. Oftentimes we walk, but we are not aware of how we walk even. We're too busy thinking about things. Oftentimes when we walk, we forgot what we see or saw. We will do one more circle. Okay. All right. Let's we'll spend a few minutes sharing the experience.
I feel like our circle got really small.
Yeah, but we can. So how was everybody's practice today? Yeah.
Peaceful, relaxing, beautiful day. Too many squirrels.
You got ADHD.
How was your practice today, Brandon?
Good. Same thing. I had a little trouble with monkey mind, but breathing was really good. It was good and relaxing.
Yeah. What do you find difficult in the practice?
That walking, I feel like I needed a bigger space to walk. Also, I feel like I should have put my shoes on and my balance wasn't the best.
Neither was mine at first.
Yeah, it's hard with the floor, especially with socks on. I either should have taken my socks off or put my shoes on. Y'all walk too slow.
Yeah.
That's the whole point.
That's the whole point. Yeah. Slow down, enjoy your walking, enjoy the surrounding, taking
I
it
feel like I
all
needed
in.
a bigger area to walk.
Well,
Well,
we can do it
sometimes
outside.
Yeah.
Sometimes
Oh, yeah.
we do it outside.
But YouTube doesn't work outside.
I love
Yeah.
looking at the pictures as I go around. Like I look at the picture,
Yeah.
and then I look over here,
Yeah.
and it just.
But did
Rebecca's
you?
talking about the screensaver runners.
Oh, I just always love the video or
Yeah.
whatever it is you play.
Yeah.
It's the Apple TV.
Did you feel the difference between the first round and the last round in how your body feels? Stability as you walk?
I don't know.
Yeah.
Maybe I think I was just focused because I felt like I needed more space.
Yeah.
And when I'm like too close to like people trying to do something, like I get like my mind needs to focus on that, and so it's hard to like focus on my like steps.
Yeah.
I like the walking meditation.
Yeah.
Relaxing, and it was good to get the body and the blood flow kind of going,
Yeah,
allow it to get to the brain and
yeah,
allow it to relax a little bit more, and also work on controlling the breathing while I took a step. And that I always try and do when I'm doing the walking meditation,
yeah,
bring me down a little bit more than just sitting.
Just getting that out there. There you go.
yeah,
So I thought it was really good. It was cleansing. It was, as Hal said, it was a beautiful day, so it was nice to look outside as we were moving around in our circle and being able to see the different squirrels playing outside.
Yes, eating my bird seed. They're all like, inspired against my birds.
Yes,
So,
they are.
yeah. So have you been able to practice more at home
We practice on and off a little bit.
on the
I think
daily?
we've done it in the backyard once or twice.
Yeah.
I tell you what's fun is like doing it with the fire. Oh, the guys
Oh,
like doing it
yeah.
with the fire.
That would be fun. Yes.
It's fun.
I like doing it with my fish tanks.
Yeah,
Oh, yeah.
definitely. So
It's like-
looking at some of the animals that we have,
Yeah,
some of the turtles, watching them swim, fish.
yeah.
I think animals naturally meditate. They just probably don't think about it.
Oh, they just do everything
Yeah.
right. I swear. Just-
Yeah, they have no worries.
yeah,
Yeah,
they do them. They do.
Yeah.
They just do.
yeah,
But for me, I really liked it. Just the first time, kind of just thinking about the trauma and stuff like that of different things and what people go through. I was thinking about the person you were talking about that had PTSD from war, and I feel like the number one thing that you need to do with trauma is grace. Because being in the war, I at first came forgiveness, you need to forgive yourself. And then it's like, well, if you were put in a situation of a war that you didn't follow, you're just serving your country and you had to kill people, that's,
yeah.
you don't need forgiveness per se for yourself, you need grace to work in that situation, in any PTSD situation. It's kind of my thoughts, because there are times we cause it ourselves, but that's for the times that we don't. And then the other way is if needed, you need to forgive yourself too.
Yeah, I
So-
can't imagine the trauma they went through though, having to kill people and then witnessing your colleagues being killed and that's
You
Yeah.
serve in the military? Did you? But you did serve in the military?
yeah.
It was good, yeah.
Yeah, but there
Or like in one of
are
your
still
stories.
people still carry the trauma with them years after years after years and couldn't get out of that. And then so that mental stress is really hard on them. And then they come out with all sorts of physical illness. So treating their physical illness is not about giving them a pill or an injection to reduce the symptoms. The root cause is that traumatic experience and the mental stress that is going on. So you want that person to heal, you really have to find a way to help them to get over that traumatic experience and be able to live in peace. And then the physical body will get better.
For me, the medicine helped me get better enough to do,
to do what you need
to get
to
out
do.
of the house, to
Yeah.
do what I needed, and
Yeah.
then through meditation, I
Right.
do
Yeah.
100,000% believe I'm better.
Yeah. But let's see, if I didn't ask you to come
And if I
to
didn't say
practice
yes,
with
I was just thinking about that.
yeah, I mean, it's about opportunities. You've been on medication, and we used medication, but you didn't get there without meditation,
Right.
and you couldn't get off 2 or 3 medication and have a best quality of life. I mean, compared to when you were on 4 medication and before you were on medication, I would say that your quality of life is better now.
Oh my God, yes.
Right? On minimum medication.
I still want to get off all of it.
But
actually.
I remember I it's the opportunity and whether or not the person is open to it. Because, for a year or two, how many times did I ask you? Learn.
Yeah.
But you were not open to it until one day you were open to it.
Yeah.
Here's the opportunity.
It's one of
And
those
you were
where you're
open
just,
to it.
you get to the end of like, what else can I do?
Yeah. But like some people are open to it, but not put it into practice or not practicing enough, the result won't come. That's why meditation is a learned experience. And if you stop practice, it goes away. The benefit goes away. So it's an ongoing practice, an ongoing skill that you want to keep. You don't want to just learn one day and not practice.
Does this help people with addiction?
All sorts of things we have proven, like at the center, and I think Dr. John Kabat-Zinn too. There's so many stories, so many centers using meditation to help addiction, smoking addiction. There's a professor who had addiction with alcohol, and he used medication. There's a medication that deter people from drinking alcohol. He used AA, group therapy. Nothing helped until he practiced meditation. But even with practicing meditation, it took him 3 years to finally kick the habit. But that story is on TED Talk also.
I wonder if this helps people with like schizophrenia and like serious like mental psychosis.
I'm not sure if we can, if it is a chemical imbalance in the brain, you have to find a way to help that. Because they need to be able to have awareness. I think you can guide them, but they have to have the awareness to know that they need to practice, and they need to practice on their own.
What about people that have serious
that can be done too. Yeah, if you read the book Vipassana meditation, life changing something. I forgot the title now. But in that book, the author wrote about how it helped people with drug addiction, smoking addiction, prisoners who did bad crimes and changed their mental state and changed their behavior as well, and they become a very good person and reformed person, being very helpful for the society and everything. So it's that I mentioned that book. I haven't read it again in so long. So it's something Vipassana meditation, life-changing experiences. Well, that they have to be open to learn. We can present the opportunity, but if they are not open to learn, then they won't. And I think people, who are on their path of searching for a solution, and they tried and they tried and they tried, and nothing helped, then they will go to meditation as the last resort, and it may help. And I'm not saying meditation is the only solution. Some people find healing in art, painting, but that's also meditation,
that's
concentration.
A form of meditation.
Yeah, it's a form of meditation. So, yeah. So. Yeah, I think the title is like Changing Lives Vipassana Meditation in Action or something like that. But
I would think with schizophrenia, I think it would be an okay thing with medication. Like I think it could help improve quality of life.
yeah, you give them the medication to help them to focus, and then you give them this skill, and then it may help. I think it has to be combined.
Yeah, that's what I was.
Yeah, yeah, but yeah. So keep practice. It changes lives.
If
for
you're
sure.
ever curious, I'm never going to look back, but you can look at the old videos on how I did versus now with meditation. Before I would have to lay down.
Oh yeah.
I couldn't do the walking.
Really?
Yeah,
This
the
is
very first.
episode
thing.
110.
Yeah. But Rebecca came in when we were, I think, like in 2000, 2003. 2003.
No, not 2003.
Yeah.
23, you mean?
Yeah, 2020.
Okay.
Yeah, 2023. Oh God, I got the number.
I'll go with that one.
Yeah. Yeah, we started this in 2022, I think.
Okay, yeah.
And then you came in a year later, so 2023. So almost 2 years now.
Get off 2 medications, lost 40 pounds.
2 or 3.
Okay.
Is it 3 years? You're off Ringworld, you're off Benlysta and azathioprine.
Okay.
Right? You're on only one med. Is it the hydroxychloroquine? Yeah.
Which I need to get off of that. So that's a side thing.
Yeah, you can. You can.
But yeah, so it's really helped me.
Yeah.
I think I'm gonna try to come a little more often.
Yeah.
Great to see you.
Yeah.
But you know, like in the case of Rebecca and my other patient who were able to get off medication, they were not able to get off medication until I think the earliest that a patient can get off medication is 6 months of practice. 6
Okay.
months of
So
meditation.
I was a little bit higher than average.
Yeah, so you took 14 months, I think, and then Sean, for him, I think it was the 16th month that he started to drop medication, and by the 18th month he was off all meds. Yeah, yeah.
It's exciting.
Yeah.
Hope.
So, yeah, but I'm not saying that it's the cure all. Like I say, you know, you have to look for root causes. Infection, for example, if you have an infection in your body and you practice meditation, does that help? Maybe it reduces the inflammation, but if you keep having that infection on and on and on and on, you can't heal until that infection is gone, right? So, yeah, but it helps. So it helps to drop that inflammatory levels enough to where it's not that very severe. Yeah.
I know stress is what causes my illness.
Yeah.
And to learn to do this, to help through stressful situations, is the best thing for me about it.
Yeah.
Is that
So
it really helps.
Yeah, and there is a large numbers of people out there whose illnesses are caused by stress. The stress is their main reason for being sick. Yeah, and this can be the tool that get them back to healing.
And my stress was caused from the trauma that made my brain, and the ADHD that just made my brain more than zoo mind, not monkey mind, but zoo mind.
Yeah.
And then the meditation helps, I should say, slow my brain down.
Right.
Like when doing the walking, I'm so excited when I have one thought in my head.
Yeah, because at the beginning when you just joined, you had more than just one thought. But you know, the more you practice, the more the brain calms down. And I find myself sometimes when I meditate, I just don't think about anything. I just know I'm here, I'm breathing, that's it. And I don't think, you know, but those moments are not long. You know, there's that moment, oh, I wasn't thinking of anything. No thought whatsoever. All I know is that I'm here, I'm seeing, I'm listening. That's it.
I've had
Yeah.
small moments, I guess. I thought
Yeah.
you meant like long moments.
A long period of time, not yet, but
Not yet.
I have those, moments of meditation where I'm not thinking about the past, the present, the future, nothing. I'm here.
Mhm.
I'm breathing. Yeah.
Yep.
But yeah.
There was
Yeah.
1 year where I got really ill with it, I think due to obsessive thinking.
Yeah.
I believe it.
Yeah.
Absolutely.
I
Right.
remember one time I got really sick with like really like the worst like stomach flu I've ever had, and it was literally I think brought on by like thoughts. And I would notice every time I would let the thoughts go, I would feel like physically feel better.
Yeah.
But when I would start thinking about them or cling to them, I would.
Right. Yeah. Attachment. You use the word clinging, and so attachment and meditation teaches us to detach or
Be your worst enemy.
on
Oh, I
being
was gonna say,
The
non-judgmental.
mind is a wonderful servant but a terrible master.
Yes,
Yes.
very good. But
Yeah.
yeah, the mind,
Yeah.
I do feel is an
Yeah.
enemy, but
Yeah.
it's also very powerful. Like you
Yeah.
can change.
Yeah.
Well, the corollary to that is that things are never as bad as you imagine.
Mm.
Unless you're about to face the death.
I like
Yeah.
how you go that extreme.
Yeah.
Well, I don't know. I think PD right now would disagree with you, but you're on trial for.
Well, things are never as bad as you imagine.
Yeah.
For most people.
Yeah.
That's what I actually try to teach some of the younger people that I work with sometimes is that, and they laugh when I say this, but I'm like, life sucks. It's never gonna like stop sucking until you die. There's always gonna be something, but it's about finding
You
the
have that to
little.
look forward to.
Yeah, right.
Yeah.
But then we hold on to death.
Life is gonna continue to suck until you die. Great.
But it's about finding the little joys in those miseries of moments. It's about, I know I'm so positive.
They're oatmeal raisin cookies is what you are, right?
I like oatmeal raisin cookies though. You just have to give up the chocolate for that
Yeah.
moment.
Yeah.
But no, just find a little joy. Joy in little. You know what I'm saying?
Yeah, little things in life.
Yes, because there's
Yeah.
always going to be a stress. There's always going to be
Yes.
something that's going to happen.
And sometimes our thought can make it worse.
Oh
Yeah. All right.
Especially when I
Well,
excessively think
yeah.
of something.
Okay. Well, with that, I thank you for joining me today for the session, and thank you everybody for watching and practicing along with us on YouTube. It's a beautiful day, so I wish everybody a very, very enjoyable weekend. Make use of the nice weather and go out there and do something fun.